So I think we'll go ahead and start the program so that people might join. Good evening all, and I welcome you all for this video launch session that we have organized today. We'll be launching the Kannada version of the video that is already there on the YouTube about the antibiotic resistance that is made by the Superheroes Against Superbugs team, which is presently it is in English. So I welcome you all for this session, and before going on, I just want everyone to see the English video. So I have shared my screen and I'll now play the English video. Can someone confirm that they can hear? Yeah, fine.
We waited for 2 days and this cold is not showing any signs of getting better. I don't think I should wait any longer. Here, I think you should start taking this. Hopefully it'll make you better.
May I see your prescription for this medicine?
I don't have any. My Amma and I picked it up from the pharmacy yesterday. May I know who you are?
I am the antibiotic you're about to pop into your mouth. Anyway, why are you taking me?
Oh, a talking antibiotic? What fun! I have a bad cold from 2-3 days. My throat hurts too. And you are a precaution to stop this from getting worse.
Don't be silly. You have nothing that needs an antibiotic. Definitely not without a prescription. See what the doctor has to say.
See, medicine is not a child's play. We doctors are here to help you. Always remember that misuse is no use.
What is wrong with you?
What's wrong with me? Nothing. The problem is you. We antibiotics are absolutely essential for health and well-being of mankind. Without us, anything from a small wound to a childbirth can sometimes put human life at risk due to deadly infections. You know the advancements in modern medicine like surgeries, organ transplants and chemotherapy? None of these would be possible without us. And here you're abusing me, using me for no reason. See what that leads to.
So nice of humans, no? To keep giving us antibiotics to make us stronger.
Yes, I agree. I wonder when they will realize that they are actually helping us rather than themselves.
Anyway, I cannot rid you of cold and flu. Both cold and flu are caused by viruses. We only work on bacteria.
What?
See for yourself. Different antibiotics work on different bacteria. We may be miracle drugs, but we are not universal. And only a doctor can tell, that too only after tests, what the right treatment is and which of us works for what you may have. But we never ever work on viruses. Yeah! And we kill bacteria effectively only if all our soldiers, that is, doses are sent in as planned. One at a time, of course.
Plan? What plan?
Well, let me explain. The plan for using antibiotics or soldiers against the bacteria has to be executed perfectly. Our plan is our strength. Do you see this red line? Any medicine with a red line, including antibiotics, should not be bought without a doctor's prescription. This is the Government of India Ministry of Health Red Line policy and is very important part of the plan. If doctor says 10 soldiers have to go in, one after another at 12-hour intervals, then it should be 10 soldiers at the correct time. If doctor says 15, then it must be 15. No more, no less. Never ever drop the plan halfway.
What will happen if I stop the plan?
Super bug! Check it out. When my first soldier goes into the body, some bacteria die. When the second soldier goes in, some more die. And same when third soldier goes in. If the soldiers keep going in as per the plan, all bacteria die. But if you stop the plan halfway through, some bacteria survive and become superbugs by changing their luck. Our keys don't fit in anymore and the antibiotic can no longer work. Next time you fall sick due to infection by same bacteria, this same antibiotic does not work.
What doesn't kill us makes us stronger. We will take revenge! Antibiotics! Superbugs!
That is bad. So, what do you suggest?
Never drop the plan. Never use antibiotics unnecessarily to begin with. If you misuse or overuse antibiotics, new powerful superbugs arise for which new powerful antibiotics are needed. We become useless and the treatments become more and more difficult. So save us, save yourself. Together, let's become superheroes against superbugs.
Absolutely! What about my cold then?
It will run its own course. Eat well, drink lots of fluids and take rest. You'll get better on your own in no time.
Got it! And I will never forget any of this. I have to tell my mom what happened. She's not going to believe me. Action! Amma? Amma?
Maintain hygiene and sanitation. Avoid infections. Avoid having to use antibiotics. Take antibiotics only when necessary and only when prescribed by a doctor. Remember the red line. Finish the full course prescribed and never share antibiotics with others.
Let's become superheroes against superbugs. Together, let's save the drugs to beat the bugs.
So I hope everyone were able to see the video completely, and I have dropped the link of the video that is already there on the YouTube in our chat box. Also, recently the video has been made into the short pieces, which is put into a playlist. I have even dropped the link for that. And now we'll move on with the session, and I think you would have observed at the end some of the names, and we are very happy that we have the Superheroes Against Superbugs team members with us. I welcome Dr. Ponnari, who is the co-lead of the Superheroes Against Superbugs and also grants manager at LV Prasad Eye Institute, Hyderabad. And also one more team member, Dr. Somdatta, who is also the Science Communications Officer at CCMB, Hyderabad. And now we'll go ahead and have discussion with them. Later, we are thrilled to release our Kannada version at the end. So please stay tuned till the end of the session. Yeah. So now I request Amrita to take over and moderate the question answer session. Hello. Amrita, you can hear us, right? You are on mute.
I think now it's okay.
Yeah.
Hi everyone. Yeah. This is a nice opportunity for all of us to bring out the Kannada version of the video. So we have noted down some questions for the team. So we would like to ask some of these questions. So yeah, whoever is like comfortable can answer with that. Yeah. Can any of you tell like a brief introduction about superheroes against superbugs? The SaS, like how does it work and then how is it organized?
Yeah, sure, Amrita. Thank you, Sachin, for inviting us to the session and also the entire ASPIC Club, Yuvaraja College, Mysuru. Right. So Superheroes Against Superbugs is an initiative that was launched in 2018. So our aim is to build a community dedicated to fighting the threat of antibiotic resistance in India. And so our mission is to sort of build a platform to initiate conversations on AMR, to promote awareness and also action against this threat. And we aim to do this through three verticals: education, engagement, and communication. And so far, we have partnered with school children in this endeavor. We make them our creative partners. So our modus operandi has been workshops for high school children. So we conduct different formats of workshops where we engage with high school kids on science, the scientific concepts behind AMR through various games and fun activities. Most of these are hands-on until now. With the pandemic, we are also going online, but mostly we do hands-on activities with these children to explain the science behind AMR. And also we encourage these children to interact with scientists, with clinicians, and various other stakeholders. So they get an all-round perspective of the problem of AMR. And once they're empowered with knowledge, then we kind of encourage them to come up with stories on various concepts of AMR that they can relate to. And then we encourage them to turn these stories into various tools. I mean, it could be, it could be posters, it could be, podcasts, it could be anything. But I think the most popular one and what became the USP of Superheroes Against Superbugs are the grassroots comics, which are black and white comics that these children draw on based on the stories that they come up with. And so these grassroots comics kind of became their unique message to the world on AMR. And the idea is that the children will then use these tools to further awareness on the problem in their sphere of influence. So that's how SAS has been working. And so though we partner with young children, we also have a presence on social media, and we do engage with other general public on the topic as well. So.
Yeah, so that's very nice, like outreach program which you're conducting. So we would also like to know, like, why school children are the target. Like, is there any specific reason why not general public, and then why specifically to children? Yeah.
So actually, we do not think that children are our sole target, but they are our partners. So through children, we want to create mechanisms of reaching out to public at large. So what it means is that, for example, the comics that the children have made with us, I mean, that's not only meant for their own peers. Of course, they are a huge population, but through them, it's their teachers, their families. Then we use them on social media. So it's definitely general public that we are overall trying to reach out to. It's just that the mechanisms that we are using, we are devising, are partnered with children. And we do that because we find them very enthusiastic, creative in ways of how they express themselves. And unfortunately, as people grow older, they're also overwhelmed and with tons of other things. So probably, I mean, unfortunately, the creativity part also takes a hit. So we try to work with children who are expressive, who are creative, and who are also in a position to grow into change makers. So we're also careful in about what kind of schools we have worked with so far, especially when we have created these comics. We have ensured that the schools are invested in the cause. So that's one thing. And also, because we have been able to combine this with education, it's an easy way for us to also gain access to schools and hence to children. So it works both ways, but the most important part is that we think that children can grow into change makers. They are creative in the ways they think. And of course, they're going to be the future antibiotic users too. So there's no way that we don't want them to be missing out on the information.
Yeah, so it's been a long time you've been like doing such kind of activities for schools, but like what are the hurdles or challenges you might have been facing like in reaching out for different schools, and also in general, like what are the difficulties you have? Yeah.
Okay, I think I'll take that question. Yeah. So I think Somdata would agree with me when I say this, that the SaS team has actually never faced any difficulty in reaching out to schools. In fact, all the schools that we've approached have been very welcoming, they've been very supportive, and in general, we found that schools are very interested in such initiatives these days. So that hasn't been a challenge at all, but I can talk about some of the challenges that we've had while engaging with AMR itself, and while communicating different concepts of AMR. So one of the most important challenges, I think, is the complexity of AMR itself. It's such a complex topic, not just the science behind AMR, but also the health and the societal implications of AMR are also so complicated, and there are so many different stakeholders, so many different things to keep in mind, that especially when you're interacting with school children, it is very challenging to kind of, dumb it down, not really dumb it down, but to kind of explain that to simplify the message, and to convey the important messages without overburdening them with too much information. The second challenge, I think, is to make the problem relatable to children, and it's not just to children. I think this is a problem even with adults as well, that how do you make it relatable to them, right? Again, because this is not something that they come across very often. Many people have not even heard of AMR. So it's like, how do you, we kind of ensure that when we are talking to children especially, we don't want the children to leave our workshops being, with a doomsday scenario, thinking that this is, oh my God, such a big problem, and there's, it's beyond us, there's nothing much that we can do about it, because that would be counterproductive. So we kind of ensure that they always leave our workshops with a call to action, that there is something that they can do about the problem. So that getting that right could also be a challenge sometimes. And the third one, I think, is again, especially when we make these tools with children, we don't want to meddle too much with the creative process, because we want children to express these, their inherent creativity. So we don't want to meddle too much with that. But at the same time, we have to ensure that the messages that go out are scientifically accurate and are rooted in science. So again, that's a difficult balance sometimes. I mean, it is a difficult balance, but we always ensure we try to keep that balance.
So that is another challenge that I can think about. And I think another one is, so what we have found is that children from different schools and different socioeconomic backgrounds actually relate to the problem of AMR very differently also. Like children from lower schools that belong to the lower socioeconomic backgrounds, they relate more to the hygiene and sanitation aspects, whereas the other children from more affluent backgrounds relate to, they engage better on overuse and misuse of antibiotics. So these are also different things that one has to keep in mind when you prepare. So it's important that the health messaging and the overall content of the workshop is actually catered and is catered towards a target audience. So this one message fits all definitely does not work with AMR at all. And that getting that right is also an important challenge that one has to keep in mind when engaging on AMR.
I might also want to add some things to it. So for example, we needed to create different formats of engagement as well. So while our flagship program has been the workshop, which runs for 3 days and culminates into making comics, I mean, students making comics, it's also a very time-intensive process. It's also a little expensive in terms of getting the right resource people. So we don't think that every school is always in a position to do that. However, then there are schools who might want to give just 1 hour for the engagement or 2 hours for the engagement. So we really have a plethora of things from just 45 minutes informational talk to the extensive workshop where the children are actually partnering with us to create content. So not just that like Ponari was saying, the details of messaging differs in both these scenarios, and also the outcomes of these different formats are different. In one case, we are only informing the people mostly. On the other hand, we are actually allowing them to create tools for informing other people around them.
All right. So it might be very, so children will have so many thoughts in their mind going on, so they would question you and all. So their imagination power would be more than whatever adult would have. So you might have like a lot of problems with achieving such kind of targets. So could you just brief upon like the strategies, what you have used, like what kind of methods, or like how did you do such kind of things?
Yeah. So actually, that was. It was very, very helpful for us that Mr. Sharad Sharma, who is the founder of World Comics India, was a part of the program wherever we needed to make the comics, which is where we encountered the most number of questions from these students, also because we spent that kind of time with them. And Mr. Sharma is very equipped as a teacher in teaching somebody storytelling, and his style of storytelling is very neat. So as a storyteller, what you get is one A4 sheet and a black sketch pen and a black pen. And each sheet is divided into 4 quadrants, and 4 panels is all that you have to tell your story. So even though one's mind might be filled with tons of questions and tons of storylines, they have to choose only one, and one that can be told in 4 blocks. So that helps. I strongly feel that really helps the young children to also channelize which story they want to tell. And then of course, because it's an activity that 30 students are doing at one go, they also see, I'm doing this one, my friend is doing that other one. So they kind of also, I felt that they divided who's working on what story, so that they also get to voice their unique stories through it, and something that relates to their lives the most, that impacts them the most, they think that is most important for them. So it worked out that way. But of course, our workshops also had many a times 4 or 5 facilitators at least for these 30 students. So we could actually divide ourselves and pay enough attention to each of these students and address their problems as much as we could. Ponari, do you want to add anything to that?
No, I think you've covered it. Yeah, so that I think worked well with the grassroots comics to channelize their creativity into one story per student. Yeah, of course they're free to make as many comics as they want once they've left a workshop. Yeah.
That's nice, yeah. So, so it's been around 2 to 3 years, I believe. So how have your activities benefited, towards achieving your defined aims? Yeah, I mean.
Okay, so that's that's a difficult question to answer because it's very difficult to measure behavior change in this group of people. But we kind of do try to integrate some evaluation measures into our program itself. So we do interact with the children at the end of the workshop to understand how much knowledge they have gained, what they've understood. And we also go back to these children after a few months to understand how much of the knowledge they have gained, have they retained, and whether they have actually used the tools that they have developed to engage with their peers, their families, their communities, whether they're actually still engaging with the topic of AMR or not. And it has been encouraging. I mean, our evaluation has shown that the children do engage with the topic beyond our workshops also. So one of the main aims of the program of SaS is to build champions, like Sundata was mentioning, to build champions, to build change makers that will then promote further awareness on AMR. And so it is very encouraging to see that some of the children from our workshops have gone on to do exactly that. One kid has done a podcast. One child has done conducted a webinar. Some of these children have gone on to interact with their peers through the school. They've interacted with their peers they've conducted workshops for their peer groups in the schools. They've displayed these, almost all of them have used the comic to go and talk about AMR with their families. So it has become a nice kind of dinner table conversation. And some of these children have displayed these comics in their communities, in their society WhatsApp groups. Some of them have displayed these comics in their local pharmacies. So it's kind of nice to see that the children are, using these tools to then talk about this problem and bring further awareness. Of course, there's been few tangible outcomes also that we can talk about. Like one of the schools that we've interacted with immediately after our workshops have gone and started these hygiene and sanitation drives in their school. So this was a government school, and the children themselves have started this drive where they would clean the entire campus, their hostel campus every week. And they've also advocated for soap dispensers to be put up near the toilets, which were previously not there. So these kind of behavior change in terms of infectious diseases and hygiene and sanitation was definitely very, very encouraging for us. So while we cannot pinpointedly say that these many people have actually stopped using antibiotics without a prescription, or because these are children, so it's very difficult to measure such outcomes also. But I think we are successfully engaging with children, and I think thanks to volunteers, we have now reached out to, I think, about 558 school children from 75 different schools from the cities of Hyderabad, New Delhi, Chennai, and Bangalore. So mostly thanks to our volunteers, but it's nice that the workshops are spreading to other cities and to various schools as well. So, yeah.
Oh, okay, that's nice. Okay, so I think Sachin would have some more questions, general questions, which he would like to ask, I think. Yeah. Yeah,
that was very insightful answers. Like, it would be a very guiding force for us if we start, when we start going to the field, like schools, or engaging with the students. It will definitely guide us how to deliver these concepts or issues to the students. So I have two broad questions where I would like even Dr. Philip, Mathew to pitch in and add his thoughts. Yeah, hi Philip. Yeah, you are muted.
Hi.
Yeah, hi. So the thing is, this COVID-19 pandemic has one way helped to sensitize about the infection control measures. I think people are more sensitized to those control measures, using sanitizer or better ways of like washing hands with soap and these kind of stuff. But in another way, it has diverted the people's attention from many of the other global health threats to only the virus and COVID-19. So how do you think this might affect particularly the AMR issue when it comes to the public health, like when we go out for awareness or when we engage with people, how this might affect the future things in this way?
So thank you, Sachin.
Yeah.
Thank you for your question, and it's very nice to see that you're very active in doing several things. So coming to your question, we had incidentally discussed this today morning, with Punnari and Sombrata in a different call. So it's very surprising that you're asking this same question. So again, as you mentioned, we have lost a lot of ground in the last couple of years in terms of political capital. Now people are not, at least the policy community is not very much interested in AMR anymore. We had a lot of momentum going with the Global Action Plan, the Interagency Coordination Group, the National Action Plans. Almost 95% of the world's population is covered by a National Action Plan. So all that was happening between 2014 and 2019, and suddenly in 2020 you find yourself somewhat marooned on an island because of obvious reasons. There's an elephant in the room. You have to address that, which is a more visible issue. COVID is a more visible issue. People are dying. You can see people suffering around you. AMR is more of an invisible issue. It's a silent, supposedly called as a silent pandemic. And we have this predictions, which says 10 million in 2050, 10 million deaths in 2050 and all that. So people feel that, it's a faraway problem. It's a medical problem. And people don't, if you look around also, if you look at your family also, you won't find people dying of AMR. You can see people dying of cancer, TB, whatnot, but then not of AMR. That's a challenge that we are facing right now. So definitely, as you said, we have lost a lot of ground, be it political capital, be it resources for implementing these action plans. We have these wonderful action plans in place. Unfortunately, there's no budget line attached to it because all the budget has been consumed for COVID-19 efforts. So there is a general lack of interest. There is a loss of political capital. There is loss of resources. So all that put together, AMR action has taken a backseat. That is the first part of my answer. Second is there are a lot of similarities between AMR and COVID-19. You are mentioning about the possible co-benefits of AMR action because of COVID. Of course, the awareness about hygiene went up. People are now more aware about cough hygiene, hand hygiene, infection prevention and control in hospital facility, healthcare facilities went up. So all those are co-benefits. But then when you actually look at things more granularly or more objectively, you can see that we have suffered more of a loss than a gain. We've definitely, if you look at it, the loss has been much greater than the gains, than the possible gains. There was an article published a few weeks back which said that antibiotic use has definitely gone up. Some people may argue that antibiotic use has come down because children are not exposed to virus and bacteria. They're not going to schools. They're protected against upper respiratory infection. But then, unfortunately, that's not true. Antibiotic use has increased across the spectrum. Be it in outpatient setting, inpatient setting, or even in intensive care. So that is one downside that we are seeing right now. We really don't know how to tackle it. That the similarity between COVID and AMR is that we are clueless about what is a rational way to tackle it. Both of these are systemic issues. If you look at COVID also or AMR also, the impact of AMR is more felt in places where the health system is deficient or it's not able to cover or give adequate care to its population. So COVID is also having the same issue. The impact of COVID has been much more in developing countries than in developed countries. So all of that put together, both these issues are systemic issues. We need to have more investment coming into the healthcare system, to the agriculture system. All of this put together can solve these issues. So I think when we are advocating about AMR in the middle of a COVID-19 pandemic, the thing that we have to focus on is the similarities between these two problems, and both these problems being systemic issues, and the need for overall across the board investment in healthcare. Right now, I think most of you are aware, we spend a very, very low amount of money of our healthcare or of our overall budgets on healthcare issues. So that definitely has to go up, either in the national level and the state level. So all of that put together, we have to have a broad community-based coalition to kind of improve our healthcare systems, and I think that is the only way in which we can fight both COVID-19 and AMR. So the advocacy efforts regarding showing these similarities and possibly highlighting the possible common entry points for both these issues has to be a focus of all our work in the next 3 to 4 years. That is what I think. Thank you.
So I think Dr. Ponnari can add few points.
Sundar, do you want to take this? Because CCMB has been working on COVID, so I'm sure Somdata will have some insights that that she can share.
Yeah, actually, I can speak from my experience at CCMB or CSIR in general, that I completely agree with Philip when we say that there are so many commonalities between COVID and AMR in not only the systemic flaws of the two, but also of the scope that both of these things have opened up. So in the last 1 year, so many diagnostic companies and surveillance strategies, vaccine strategies, they have come up. So while COVID compelled the community to come up with these, now it is time for AMR advocates, or in general people who are advocating for fighting infectious disease burden in India, to now push it for non-COVID diseases as well. And this is going, I mean, while there is of course lack of funding, and that's probably a constant all the time in India. So while that is going to stay, it actually is in the benefit of the country as well to convince them that, okay, you have now set these things in place, and these are not just going to go away with COVID. You can actually use them further for these different things. So your return on investment is also going to be better, and that profits everybody, like people who invested in them, funded them, entrepreneurs who are running them, as well as, of course, the society that needs it. So now it's going, I mean, it remains to be seen, of course, if the will remains once COVID goes away. But I think in some ways, COVID-19 has also positioned us well to pitch for this possibility.
Yeah, thank you for that. And one more interesting question for me is that you are all working in the this area of AMR issue, like creating awareness and engaging with the people. So what do you think so far when it comes to the Indian perspective, what has to be addressed and what we are lacking in the field with respect to the awareness programs?
So I'll give one of my perspectives, and I guess Ponnari, Philip will also have very insightful thoughts on this. So in the last 3 years when I've worked on this, and at SaS, we have tried to have one central messaging that follow your doctor's advice, don't self-medicate, and follow what the doctor asks you to do. And by that, we are centrally assuming that everybody has access to doctors, which is of course not the case for the entire of India. But then me, or even the SaS team in general, we are all urban people with urban upbringing who live in urban spaces. I don't think we even have the expertise to think what it must be like for the rural population, what should the right messaging be for them, and what would be feasible strategies for them. And if you ask me personally, that is something I would definitely want to invest in finding out in the coming years, probably with partners who understand those spaces better.
Yeah, I think we can hear from. Yes.
Okay. So I think one of the biggest problems that we have in general with community engagement on AMR, probably not just in India, but across the globe also, I think is making the problem relatable to people. I mean, building on what Philip just mentioned, right? I mean, it's an invisible thing. You don't hear of, your relatives or, people affected by AMR, or so it's like, I think that is a very, very big challenge, I think, because again, building on what Philip said, when you look at breast cancer awareness, or when you look at HIV, or when you look at all of these other issues, then those are visible. All of us know someone who's been affected by cancer. All of us have seen these celebrities, or people who beat cancer, and therefore we see that we understand the problem and all of that. Whereas AMR, I think, especially, I mean, it's everywhere, but especially in India, it's like, even if the person suffering with AMR probably does not know that he's, that the issue is AMR, because he's not, all he knows is that he has this infection, right? And then, so even when, even when the person dies, the only thing that is put on the death certificate, or only thing that has been told to the relatives, is that the person died of, of the original cause, the infection, the cancer, the operation, the surgery, so on and so forth, and not drug resistance. So I think that is one of the biggest challenges, because that is, even though we rattle out all of these statistics that, 50 million people are going to die, or 25 million people are going to die in so and so a year, and this and that, it's like very far away for people. They don't see that, right? I mean, it's just some statistic out there that they can't really relate to. So I think personalizing that messaging and bringing out human stories, and bringing out the personal accounts of people that have actually gone through this problem, I think that is the way forward, I think. I mean, only then will people take this seriously. I mean, that's my personal take on it. Yeah. So
I think the biggest challenge that we face right now, I think both of them have put it wonderfully well, is how do you translate this awareness into behavioral change? What do we expect people to do? So it's very difficult. AMR being such a multi-dimensional, complex issue, it becomes very difficult for us to define a positive, good behavior from people. Like, if you have an anti-tobacco campaign, the behavior is quite well defined. You're not supposed to use any tobacco products. But then in our case, it's so complex. And the other side of it is, are we targeting the right population, or the demographic group, or the professional or occupational group? Like, if you take the example of COVID-19, some prescriptions were ridiculous, actually. After 1 day of fever, a positive antigen test, you're giving 16 to 20 different kinds of medicine to a 35-year-old perfectly healthy young person. So I don't know what kind of medicine is that. Definitely not taught in medical colleges. So are we targeting the right group? Should we target professional groups, prescribers more? So these are all questions that we have. We are still not able to answer. And then coming on to the cultural issues, cultural adaptation. You mentioning about the red line campaign of the government of India. So again, red is an auspicious thing in Indian culture, right? Like, we all use red in auspicious. Like, for a Western culture, red is something. I'm just giving you an example of some behavioral issues in planning out many of our campaigns. Probably some other color may have been a signal of danger in our culture. So broadly saying, all these kind of awareness related exercises, we have to make sure that it undergoes a socio-cultural adaptation. So all that put together, awareness, I think, is the biggest challenge that we face right now. Stewardship, targeting consumers, we have more or less understood what works and what doesn't work. But then for awareness and behavioral change, we are still struggling in the dark. So I think that is a gray area that all of us are working together on, be it ASPIC YCM, or be it React, or be it Superheroes Against Superbugs. So that is a real challenge that we possibly need to sort out in the next few years' time. Thank you.
So thank you very much. I think all three of you have pointed out beautifully the points that we have to concentrate on. So moving on to the exciting part of this session. So we will now go on with our information about our Kannada video. So I would like Anita to just brief up about the overall our experience and the excitement we are having with the making of this video. Over to you, Anita.
Okay. Am I audible?
Yeah, we can hear you.
My hearty welcome to all. I'm Neeta Tilosh, and I'll be telling our side of the story, like how it all started and how we made it through. So this all began in mid-April when we happened to see an animated video on superheroes against superbugs on YouTube, and we were kind of thrilled to see cartoons talking about antibiotic resistance and, of course, the talking antibiotic concept. So we were already a little well-versed in editing videos for posts and videos on our social media pages. So when we saw this video, we had a thought like, why not do a whole video on this topic? So we thought this video on superheroes against superbugs was perfectly conveying all the required message, and we wanted this video itself, but in our local language, so that we can reach more people. We reached out to the team and obtained the original files, and we are thankful for their help. First, we translated all the dialogues into Kannada and prepared a script for the same. But it became a little complicated because we had used literary Kannada and the dialogue timings did not match, and our dialogues were a mouthful. So we thought of simplifying it and rewrote the whole script in simple spoken Kannada with a mix of common English words so that everybody can understand. After finalizing the script, we put together a team for the voices of those characters and started practicing. We practiced for around 2 weeks and got through with all the dialogues, and their timings to match the video. We couldn't meet due to this pandemic, so we had online sessions for practice and recordings. Then we individually recorded all the dialogues on our phones itself, edited them, and added them to the video with all the fine modulations required. We are proud to tell you that we did all the practice sessions and recordings with the minimal resources we had to get maximum impact out of it. So we hope we have not compromised the standards of the original video. You can drop a mail on our official email ID for the further details. We'll be happy to help. Our prime goal of remaking this video in Kannada is to reach out to more people locally and spread awareness about antibiotic resistance among common people. With this small initiative, we might not change the world on a big scale, but we really hope to create a better environment and change the world for as many people as possible by sharing our knowledge. So I think I've spoken enough. Thank you all for your cooperation. We will be now playing our video. I hope you'll enjoy it.
Yeah, no, I think everyone can see the screen that I have shared, and now I'll be making the video public on our YouTube channel. And also I'll just share the tab and play the complete video. Yeah, hope everyone can see the screen. Was the sound audible or?
Yes, yes.
Yeah, fine.
2 ದಿನ ಆಯಿತು, ಆದರೂ ಈ ನೆಗಡಿ ಕಮ್ಮಿ ಆಗೋ ಲಕ್ಷಣ ಯಾವುದೂ ಕಾಣ್ತಾ ಇಲ್ಲ. ಇನ್ನು ಕಾಯೋದ್ರಲ್ಲಿ ಅರ್ಥ ಇಲ್ಲ. ನೋಡು, ನೀನು ಇದನ್ನು ತಗೊಳಕ್ ಶುರು ಮಾಡು, ಆಗ್ಲಾದ್ರೂ ನೆಗಡಿ ಕಮ್ಮಿ ಆಗುತ್ತೆ.
ನೀನು ತಗೋತಾ ಇರೋ ಮಾತ್ರೆಗೆ ಡಾಕ್ಟರ್ ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್ ಇದೆಯಾ?
ನನ್ನ ಹತ್ರ ಇಲ್ಲ. ನಾನು ಮತ್ತೆ ಅಮ್ಮ ನಿನ್ನೆ ಮೆಡಿಕಲ್ ಶಾಪಿಂದ ತಂದಿದ್ದು. ನೀನ್ ಯಾರು ಅಂತ ತಿಳ್ಕೊಬೋದಾ?
ನಾನು ನೀನು ತಗೊಳಕ್ ಹೊರಟಿರೋ ಆಂಟಿಬಯೋಟಿಕ್. ಅದಿರ್ಲಿ, ನೀನ್ ನನ್ನನ್ನು ಯಾಕೆ ತಗೋತಿದ್ಯಾ?
ಓ, ಮಾತನಾಡೋ ಆಂಟಿಬಯೋಟಿಕ್ ಮಜವಾಗಿದೆ. ನನಗೆ 2-3 ದಿನದಿಂದ ತುಂಬಾ ಶೀತ ಹಾಗೂ ಗಂಟ್ಲು ಕೂಡ ತುಂಬಾ ನೋವಾಗ್ತಿದೆ. ನಿನ್ನ ತಗೊಳ್ಳೋದ್ರಿಂದಾನೇ ಇದೆಲ್ಲ ಸರಿ ಮಾಡೋದಕ್ಕೆ ಸಾಧ್ಯ.
ಹುಚ್ಚುಚ್ಚಾಗಿ ಮಾತಾಡ್ಬೇಡ. ನಿನಗೆ ಆಂಟಿಬಯೋಟಿಕ್ ತಗೊಳ್ಳೋಂಥದ್ದು ಏನೂ ಆಗಿಲ್ಲ. ಡಾಕ್ಟರ್ ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್ ಇದೆ ಅಂತೂ ತಗೊಳ್ಳೇಬಾರ್ದು. ಅಲ್ಲಿ ನೋಡು ಡಾಕ್ಟರ್ ಏನ್ ಹೇಳ್ತಾರೆ ಅಂತ.
ನೋಡಿ, ಮೆಡಿಸಿನ್ಸ್ ಅನ್ನೋದು ಮಕ್ಕಳ ಆಟವಲ್ಲ. ನಾವು ಡಾಕ್ಟರ್ಸ್ ಇರೋದೇ ನಿಮಗೆ ಹೆಲ್ಪ್ ಮಾಡೋದಿಕ್ಕೆ. ಯಾವಾಗಲೂ ನೆನ್ಪಿಟ್ಕೊಳ್ಳಿ, ತಪ್ಪಾಗಿ ಬಳಸೋದ್ರಿಂದ ಏನೂ ಪ್ರಯೋಜನ ಆಗಲ್ಲ.
ನನ್ ತಲೆ ಕೆಡಿಸ್ತಿದ್ಯಾ ನೀನು?
ಯಾಕೆ? ನಾನೇನ್ ಮಾಡಿದೆ? ಪ್ರಾಬ್ಲಮ್ ಇರೋದು ನಿಮ್ಮಲ್ಲೇ. ನಾವು ಆಂಟಿಬಯೋಟಿಕ್ಸ್ ಮನುಷ್ಯರ ಆರೋಗ್ಯ ಮತ್ತು ಒಳಿತಿಗಾಗಿ ಅತ್ಯವಶ್ಯಕ. ನಾವಿಲ್ಲದೆ ಒಂದು ಸಣ್ಣ ಗಾಯದಿಂದ ಹಿಡಿದು ಹೆರಿಗೆವರೆಗೂ ಉಂಟಾಗುವ ಭಯಾನಕ ಸೋಂಕು ಮನುಷ್ಯನ ಜೀವಕ್ಕೆ ಅಪಾಯ ತರಬಹುದು. ನಿನಗೆ ಆಧುನಿಕ ವೈದ್ಯಕೀಯ ವಿಧಾನಗಳಾದ ಸರ್ಜರಿ, ಅಂಗಕಸಿ ಮತ್ತು ಕೀಮೋಥೆರಪಿ ಗೊತ್ತಾ? ಇವುಗಳು ಯಾವುದು ನಾವಿಲ್ಲದೆ ಸಾಧ್ಯವಿಲ್ಲ. ಆದ್ರೆ ನೀನ್ ನನ್ನ ತಪ್ಪಾಗಿ ಉಪಯೋಗಿಸ್ಕೋತಾ ಇದ್ಯಾ. ನೋಡು ಅದರಿಂದ ಏನಾಗುತ್ತೆ ಅಂತ.
ಮನುಷ್ಯರು ಎಷ್ಟು ಒಳ್ಳೆಯವರಲ್ವಾ, ನಮಗೆ ಆಂಟಿಬಯೋಟಿಕ್ಸ್ ಕೊಟ್ಟು ತುಂಬಾ ಸ್ಟ್ರಾಂಗ್ ಮಾಡ್ತಿದ್ದಾರೆ. ಹೌದು, ನಾನು ಒಪ್ತೀನಿ. ಇದರಿಂದ ಅವರಿಗಿಂತ ಜಾಸ್ತಿ ನಮಗೆ ಉಪಯೋಗ ಆಗುತ್ತೆ ಅಂತ ಯಾವಾಗ ಗೊತ್ತಾಗುತ್ತೋ ಏನೋ.
ಅದೆಲ್ಲ ಇರ್ಲಿ, ನಾನು ನಿನ್ನ ನೆಗಡಿ ಹೋಗ್ಸಕ್ಕಂತೂ ಆಗಲ್ಲ. ನೆಗಡಿ ಶೀತಗಳು ಉಂಟಾಗುವುದು ವೈರಾಣುಗಳಿಂದ. ನಾವು ಬರೀ ಬ್ಯಾಕ್ಟೀರಿಯಾಗಳ ವಿರುದ್ಧ ಕೆಲಸ ಮಾಡೋದು.
ಏನು?
ನೀನೇ ನೋಡು, ಬೇರೆ ಬೇರೆ ಆಂಟಿಬಯೋಟಿಕ್ಗಳು ಆಯಾ ರೋಗಾಣುಗಳ ವಿರುದ್ಧ ಮಾತ್ರ ಕೆಲಸ ಮಾಡೋದು. ನಾವು ಅದ್ಭುತವಾದ ಔಷಧಿಗಳಾಗಿರ್ಬೋದು, ಆದರೆ ಎಲ್ಲ ರೋಗಕ್ಕೂ ಅಲ್ಲ. ಒಬ್ಬ ವೈದ್ಯ ಮಾತ್ರ ಹೇಳ್ಬೋದು, ಅದು ಪರೀಕ್ಷೆ ನಂತರವೇ ಸರಿಯಾದ ಚಿಕಿತ್ಸೆ ಯಾವುದು ಮತ್ತು ಯಾವ ಆಂಟಿಬಯೋಟಿಕ್ ನಿಮಗೆ ಉಪಯೋಗ ಆಗುತ್ತೆ ಅಂತ. ಆದರೆ ನಾವು ವೈರಾಣುಗಳ ವಿರುದ್ಧ ಯಾವತ್ತೂ ಕೆಲಸ ಮಾಡಲ್ಲ. ಹೌದು, ನಾವು ಎಲ್ಲ ಬ್ಯಾಕ್ಟೀರಿಯಾಗಳನ್ನ ಕೊಲ್ತೇವೆ. ಅದ್ಯಾವಾಗ ಗೊತ್ತಾ? ನಮ್ಮ ಎಲ್ಲ ಸೈನಿಕರು ಅಂದರೆ ನಮ್ಮ ಡೋಸ್ ಪ್ಲಾನ್ ಪ್ರಕಾರ ಇದ್ರೆ ಮಾತ್ರ. ಆದ್ರೆ ಒಮ್ಮೆಗೆ ಒಂದು ಮಾತ್ರೆ ಮಾತ್ರ.
ಪ್ಲಾನ್? ಯಾವ ಪ್ಲಾನ್?
ನಾನು ನಿಂಗೆ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡ್ತೀನಿ. ಆಂಟಿಬಯೋಟಿಕ್ಸ್ ಅಥವಾ ಸೋಲ್ಜರ್ಸ್ನ ಬ್ಯಾಕ್ಟೀರಿಯಾಗಳ ವಿರುದ್ಧ ಬಳಸುವಂತಹ ಪ್ಲಾನ್ನ ಸರಿಯಾಗಿ ಅನುಸರಿಸಬೇಕಾಗುತ್ತೆ. ನಮ್ಮ ಪ್ಲಾನೇ ನಮ್ಮ ಶಕ್ತಿ. ನಿನಗೆ ಈ ಕೆಂಪು ರೇಖೆ ಕಾಣಿಸ್ತಿದ್ಯಾ? ಈ ಕೆಂಪು ರೇಖೆ ಇರುವ ಯಾವುದೇ ಔಷಧಿ ಆಂಟಿಬಯೋಟಿಕ್ಸ್ ಸೇರಿಸಿ ಡಾಕ್ಟರ್ನ ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್ ಇದೆ ತಗೊಳ್ಳೇಬಾರದು. ಇದು ಭಾರತ ಸರ್ಕಾರ ಆರೋಗ್ಯ ಸಚಿವಾಲಯದ ಕೆಂಪು ರೇಖೆ ನೀತಿ. ಇದು ಪ್ಲಾನ್ನ ಬಹು ಮುಖ್ಯ ಅಂಶ. ಡಾಕ್ಟರ್ 10 ಸೈನಿಕರು ಒಬ್ಬರ ನಂತರ ಒಬ್ಬರು 12 ಗಂಟೆಗಳ ಅಂತರದಲ್ಲಿ ಒಳಗೆ ಹೋಗ್ಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ 10 ಸೈನಿಕರು ಹೋಗ್ಲೇಬೇಕು. ಡಾಕ್ಟರ್ 15 ಅಂದ್ರೆ ಅದು 15 ಆಗಿರ್ಲೇಬೇಕು. ಅದಕ್ಕಿಂತ ಕಮ್ಮಿನೂ ಇಲ್ಲ, ಜಾಸ್ತಿನೂ ಇಲ್ಲ. ಈ ಪ್ಲಾನ್ ನ ಯಾವತ್ತೂ ಮಧ್ಯದಲ್ಲಿ ನಿಲ್ಲಿಸಬಾರ್ದು.
ನಾನು ಈ ಪ್ಲಾನ್ ನ ಮಧ್ಯದಲ್ಲೇ ನಿಲ್ಸಿದ್ರೆ ಏನಾಗುತ್ತೆ?
ಸೂಪರ್. ಅಲ್ಲಿ ನೋಡು, ನಮ್ಮ ಮೊದಲನೇ ಸೈನಿಕ ದೇಹದೊಳಗೆ ಹೋದ್ಮೇಲೆ ಕೆಲವು ಬ್ಯಾಕ್ಟೀರಿಯಾ ಸಾಯುತ್ತೆ. 2ನೇ ಸೈನಿಕ ಹೋದಾಗ ಇನ್ನು ಕೆಲವು ಸಾಯುತ್ತೆ. 3ನೇ ಸೈನಿಕ ಹೋದಾಗೂ ಹಾಗೆ ಆಗುತ್ತೆ. ನಮ್ಮ ಪ್ಲಾನ್ ಪ್ರಕಾರ ಎಲ್ಲ ಸೈನಿಕರು ಒಳಗೆ ಹೋದ್ರೆ ಎಲ್ಲಾ ಬ್ಯಾಕ್ಟೀರಿಯಾಗಳು ಸಾಯುತ್ತೆ. ಆದ್ರೆ ನೀನು ಪ್ಲಾನ್ ನ ಮಧ್ಯಕ್ಕೆ ನಿಲ್ಲಿಸ್ಬಿಟ್ರೆ ಬ್ಯಾಕ್ಟೀರಿಯಾ ಬದುಕುಳಿದು ತಮ್ಮ ಬೀಗ ಬದಲಾಯಿಸಿ ಸೂಪರ್ ಬಗ್ಸ್ ಆಗ್ಬಿಡುತ್ತೆ. ನಮ್ಮ ಬೀಗದ ಕೈ ಬದಲಾದ ಬೀಗಕ್ಕೆ ಹೊಂದದೆ ಆಂಟಿಬಯೋಟಿಕ್ಸ್ ಕೆಲಸನೇ ಮಾಡಲ್ಲ. ಮುಂದೆ ನೀನು ಇದೇ ಬ್ಯಾಕ್ಟೀರಿಯಾದಿಂದ ಕಾಯಿಲೆ ಬಿದ್ದಾಗ ಇದೇ ಆಂಟಿಬಯೋಟಿಕ್ ಕೆಲಸ ಮಾಡಲ್ಲ.
ನಮ್ಮನ್ನು ಯಾವುದು ಕೊಲ್ಲಲಾಗುವುದಿಲ್ಲವೋ ಅದು ನಮ್ಮನ್ನು ಬಲಿಷ್ಠರನ್ನಾಗಿ ಮಾಡುತ್ತದೆ. ನಾವು ಸೇಡು ತೀರಿಸಿಕೊಳ್ಳುತ್ತೇವೆ.
ಆಂಟಿಬಯೋಟಿಕ್ಸ್ ಮುರ್ದಾಬಾದ್, ಸೂಪರ್ ಬಗ್ಸ್ ಜಿಂದಾಬಾದ್.
ಓ, ಇದು ಸರಿ ಅಲ್ಲ. ಮತ್ತೆ ನಾನೇನು ಮಾಡಬೇಕು ಇವಾಗ?
ಪ್ಲಾನ್ನ ಯಾವತ್ತೂ ಅರ್ಧಕ್ಕೆ ನಿಲ್ಲಿಸಬಾರ್ದು. ಆಂಟಿಬಯೋಟಿಕ್ಸ್ಗಳನ್ನ ಅಗತ್ಯ ಇಲ್ಲದೆ ತಗೊಳ್ಳೇಬಾರ್ದು. ಅವುಗಳ ದುರುಪಯೋಗ ಅಥವಾ ಅತಿಯಾದ ಬಳಕೆಯಿಂದ ಹೊಸ ಹೊಸ ಸೂಪರ್ ಬಗ್ಗಳು ತಲೆ ಎತ್ತುತ್ತವೆ. ಇದಕ್ಕೆ ಹೊಸ ಶಕ್ತಿಶಾಲಿ ಆಂಟಿಬಯೋಟಿಕ್ಗಳು ಬೇಕಾಗುತ್ತೆ. ನಾವು ನಿರುಪಯುಕ್ತರಾಗ್ತೇವೆ ಮತ್ತು ಚಿಕಿತ್ಸೆ ಹೆಚ್ಚು ಕಷ್ಟಕರವಾಗ್ಬಿಡುತ್ತೆ. ಅದಕ್ಕೆ ನಮ್ಮನ್ನು ರಕ್ಷಿಸು, ನಿನ್ನನ್ನು ರಕ್ಷಿಸಿಕೋ. ನಾವು ಒಟ್ಟಾಗಿ ಸೂಪರ್ ಬಗ್ಸ್ಗಳ ವಿರುದ್ಧ ಸೂಪರ್ ಹೀರೋಗಳಾಗೋಣ.
ಖಂಡಿತವಾಗಿಯೂ. ಮತ್ತೆ ನನ್ನ ನೆಗಡಿ ಗತಿ ಏನು?
ಅದು ಅದರದೇ ಆದ ಸಮಯ ತಗೊಳುತ್ತೆ. ಸರಿಯಾದ ಆಹಾರ, ದ್ರವ ಪದಾರ್ಥಗಳು ಮತ್ತೆ ವಿಶ್ರಾಂತಿ, ಇವುಗಳಿಂದ ನೀನೇ ಸರಿ ಹೋಗ್ತೀಯಾ?
ತಿಳಿಯಿತು. ಇದನ್ನ ನಾನು ಯಾವತ್ತೂ ಮರೆಯಲ್ಲ. ಇಲ್ಲೇನಾಯ್ತು ಅಂತ ನನ್ನ ಅಮ್ಮಂಗೆ ಹೇಳಲೇಬೇಕು. ಅವ್ರು ನನ್ನ ಖಂಡಿತ ನಂಬೋದಿಲ್ಲ. ಅಮ್ಮ ಅಮ್ಮ.
ಶುಚಿತ್ವ ಹಾಗೂ ನೈರ್ಮಲ್ಯವನ್ನು ಕಾಪಾಡಿ ಸೋಂಕುಗಳನ್ನು ತಡೆದು ಆಂಟಿಬಯೋಟಿಕ್ಗಳ ಬಳಕೆಯನ್ನು ತಪ್ಪಿಸಿ. ಅಗತ್ಯ ಬಿದ್ದಾಗ ಮಾತ್ರ ಆಂಟಿಬಯೋಟಿಕ್ಗಳನ್ನು ಸೇವಿಸಿ ಮತ್ತು ವೈದ್ಯರ ಅನುಮತಿಯ ಮೇರೆಗೆ ಮಾತ್ರ. ನೆನಪಿಡಿ, ಕೆಂಪು ರೇಖೆ. ತಿಳಿಸಿರುವ ಪೂರ್ತಿ ಅವಧಿಯನ್ನು ಮುಗಿಸಿ ಹಾಗೂ ಬೇರೆಯವರಿಗೆ ಸೂಚಿಸಿರುವ ಆಂಟಿಬಯೋಟಿಕ್ಗಳು ನಿಮಗೆ ಸೂಕ್ತವಾಗಿರುವುದಿಲ್ಲ.
ಸೂಪರ್ ಬಗ್ಸ್ಗಳ ವಿರುದ್ಧ ಸೂಪರ್ ಹೀರೋಗಳಾಗೋಣ ಹಾಗೂ ರೋಗಾಣುಗಳನ್ನು ಹೊಡೆದೊಡಿಸಲು ಆಂಟಿಬಯೋಟಿಕ್ಸ್ಗಳನ್ನು ರಕ್ಷಿಸೋಣ.
So I would like to pause here a bit and acknowledge the dedication and support that we have received as a team for this video. I would like to introduce myself, Sachin. I have just started with this script. I just started with the script, and later we were helped by Prayag J. Kore, who is a cinema artist. And also we have with us Amrita H.C., who is the final year PhD student at the CCMB. And we also got help from one of our seniors, Ramya R., who is working as project assistant in CFTRA, Mysore. And I think you would have recognized the voice of the girl that has been given by Neeta. And also the voice for antibiotic was given by Prayag. And other voices included Ramya, Sanjana is the faculty from our department, Mridula, and myself. So we would like to acknowledge the support that we have been receiving from Professor N.S. Devaki, course coordinator, Department of Molecular Biology, Yuvaraja College, and also the entire Department of Molecular Biology, Yuvaraja College, the ASPIC Clubs Network, the React Asia Pacific, and also we would like to acknowledge the Superheroes Against Superbugs team for letting us, providing us with the original files and helping us technically towards this video. Thank you one and all.
If I can just say a few words.
Yes.
That's okay. So congratulations to the entire team. Job very well done. Though I don't understand Kannada, but I could see that the dubbing was really well done, and it was very. I mean, the voiceovers were very nice, and the lip sync and everything worked really well. And one of the reasons why we made the original video itself was because we found that the videos that were out there were not the children, especially from the government schools, were not able to understand the concepts in some of those videos. It was very difficult because of the language, the accent. So we felt that we needed to contextualize. We needed an Indian context in the video. We needed to have Indian accents, so these can reach to a wider audience. And of course, I mean, it's very, very important that the language, language plays a very important role here, and it's very important that these videos are made in vernacular languages so that they are available to a much wider audience. So thanks to ASPIC Club YCM for taking this initiative and for doing such a wonderful job of it. And I could see the smiles beaming on Sachin's and, Neeta, right? Yeah.
Yes, yes,
so I could see that you've really enjoyed the process. So that is
we
the
have
most important
enjoyed
thing.
our practice, all our sessions. We have enjoyed it thoroughly.
Yeah, so that's great. So keep the good work going. And also, I just wanted to say, if ever you decide to engage with school children or anything like that, all of our resources are available on our website. So you have detailed lesson plans and workshop ideas and things like that that you can that you can also maybe use if you feel like using them. Yeah, that's all. Thank you again.
Yeah, thank you very much. And we have our future plans, like to make this video more familiar to the school children, or spread it in other platforms rather than YouTube, because YouTube, I think maybe the common people, much more common people cannot reach to this platform. So I think we need to use other platforms which are more associated with school children or something like that, so that the message is properly delivered. But I think we have, at least I believe we have taken a step forward to just deliver what Dr. Ponnari was saying, like the Indian context. I think this is an addition, like making the video available in other common languages as well. So thank you very much for all the support that we have been receiving from the ASPIC Clubs Network and also the Superheroes Against Superbugs team. So thank you very much for being part of this session. Thank you one and all.